Good afternoon, Jalandhar. You are tuned into 15.20 FM Jalandhar, Punjab. And I am your host, Kajal Goswami, welcoming you to today's special health awareness segment. Today's discussion is extremely important, something that affects almost every household. We are going to talk about common conceptions about antibiotics. What is true, what is misunderstood, and what could actually be dangerous. To guide us through this important conversation, we have a very special guest in the studio, Dr. Manpreet Kaur, MD Medicine, Fellowship in Infectious Diseases. Ma'am, welcome to 15.20 FM.
Hello, my greetings to all the listeners around here.
Ma'am, let's begin with something common. Okay, so my first question to you would be, how harmful can it be if people take medicine on their own without a doctor's advice?
First of all, I'll think that whenever we think of any problem, we should always consult the concerned person. Suppose if there is something wrong with our clothes, we should consult the tailor. But so if there is something wrong with our body, we should definitely consult the doctor. That is very important. That is important for our health, for our overall well-being. If we don't follow those, then maybe you have a short-term benefit, but long-term it can affect your health.
That's truly concerning, ma'am, because many people feel it's harmless to take medicine suggested by friends or pharmacists. So the second question would be, why do many people think antibiotics work for every sickness, even when they do not need it actually?
The problem is here, ma'am, whenever we think that antibiotics will cure our sickness very early, like if we will get better in 3 days with antibiotics, we will get better in 1 day, and more often we also stop the medicine early. But all these things, they lead to serious consequences later on. We all know that whenever our child gets sick, we just go to the medical shop, and they also have a habit of giving us together with symptomatic treatment antibiotics. And these antibiotics, they are definitely, we have to follow antibiotic stewardship program, which is strictly followed in the countries outside India. That overall it impacts our health, it overall decreases the health resistance. So it all starts with us. We should be like a little bit aware about what medicines we should take and what we should not.
So listeners, this is something we all need to think about. Every fever does not mean antibiotics are required. So ma'am, from your daily experience, what is the most common wrong belief about health that you see in your daily practice?
Number one is what you have already told, that every fever needs an antibiotic. I would like to say that fever is not entirely due to infection. Sometimes it is due to some response, like it could be part of your autoimmune disease, like rheumatoid arthritis. It could be drug-induced fever, some medicine we are taking because of that. It could be a fever. It could be as a part of malignancy, cancer popularly known as. So every fever is not because of infection, and even if it is because of infection, it is not because of bacterial infection. Antibiotic, mainly it is against bacteria. It is not against any viral or any fungal. So first get yourself diagnosed, then only get treated. What I would like to say is, follow the proper road, then only you will go to the proper destination. Don't go here and there.
That's very insightful. Now here is something many people are guilty of. So ma'am, why do many people stop taking antibiotics once they start feeling better, and how dangerous that can be?
It's a common human instinct, ma'am. When we don't need the people, we throw them off. Similarly, when we don't need the thing, we throw them off. So it's a common human psychology. But I would like to say here that, see, antibiotics, like when we take it, we have to complete the full course, and that is as advised by physician. Antibiotics, they decrease the level of bacteria in our blood, and if we stop it in between, then the resistant ones, they grow up later on, and whenever you're going to have a second time infection, it would be more severe. So it's important that these antibiotics, they have to be taken with the prescription of doctor for the duration prescribed by the doctor, and a dose as per doctor. Don't experiment with this thing. This is something which is very important.
This brings us to even bigger issue affecting the whole world. So how does stopping antibiotics, which you very well explained in the previous question, so how does it affect both your health and the spread of recent bacteria that keep occurring in your body?
See, there is something which is coming up: antibiotic stewardship and superbugs. Initially, we all know that whenever, like 20, 30 years before, whenever the kids used to get infected or any adult used to get infected, we used to give them simple amoxi capsule and they used to get well. But now we are very well aware of augmentin. Augmentin is a way higher than amoxicillin. And now what we are coming across in our day-to-day practices, like we have to give a very high level of antibiotics. Why so? Because at the early young age, we have started giving antibiotics for the simple minor infections. I don't say that we don't need antibiotics for treating the infections. We definitely need them so. But when and where is to be given, there are certain red flags to consider for the same. And if we continue to take antibiotics for the unnecessary infections, then ultimately our body will get resistant, and the resistant bugs, we are left with no antibiotics. Now when any patient who comes to us in tertiary hospital, he has already taken the level 1 level 2 kind of antibiotics from here and there. I might not mention, but they must have taken the antibiotic from here and there, and even the injectables not in proper dose, not in proper duration. So when they come up to us, then they are all sick, they are all in sepsis, and the cost and burden of treatment, it increases, because the antibiotics need to treat a superbug is very, very high. It definitely adds to your pocket. So a simple way earlier will help you in the long term. So always consult your physician, always consult the person who is expert in that field.
Dr. Manpreet, thank you so much for sharing such valuable information with us.
Thank you. It was nice being here.
To all our dear listeners, please remember: number 1, never self-medicate. Number 2, never share antibiotics. Number 3, always complete your prescribed course. Last but not the least, number 4, consult a qualified doctor before taking any medication. You were listening to 15.20 FM Jalandhar, Punjab, and I am Kajal Goswami signing off for now. Stay informed, stay healthy, and stay responsible.